All right, hey guys, it has been a while since we've done a live, and Dr. Gallus is going to pop on in a second. I was a little late. It's the classic, I have time to do one more thing, but I really don't. That's why I'm always 5 minutes late everywhere. I think I have time. All right, and I see her, so let me invite her to join. If I can, there we go. And we'll get her on. It's been a little while. We are taking questions tonight. If you have questions about things, put them in the comments. We will be happy to answer them. I want to say we're talking about fillers. Honestly, it's been over a month since we've done a live because, let me think. Oh, one of my kids was having a meltdown. Then Dr. Gallus was stuck in the OR, and then I got COVID. So it's been a little while since we were able to get together. And let's see, waiting for Dr. Gallus to join. But if you guys have any specific topics you want to hear about, I know we've talked about tummy tuck, we talked about breast augmentation, I think even facelift, and covered kind of general ways that we do these surgeries, how we do pain control, what the recovery is like. Okay, I think Dr. Gallus is having, oh, there, she came on her other account. Let me invite her there. See, we figured it out. I hope you guys are having a good night. It's 8:30 here Eastern time. Hey!
Hey!
How are
Sorry,
you?
of course I had technical difficulties.
That's okay. I did the classic, like, oh, I have 5 more minutes. And then I'm like, oh, crap, no, I don't.
Yeah. And then when I did it, there's a new thing on Instagram now. If you double tap on your account, you can switch between accounts.
Oh, yeah, I've seen that. So you were on the wrong account?
So I was on the right account, and then I went to like go request, and I hit the wrong thing, and then I'm like, ah! And then it just made me feel old. Okay.
You're not old. I do the same, or I'm old too.
You're like,
no, that's also
just, you touch something on the screen, and you're like, no, take it back. How are you? It's been so long.
I know. I was just giving a recap for everybody. Like, I had a kid meltdown, then you were stuck in the OR, then I had COVID. That was like a month and a half
Then it was
later.
My birthday.
Oh, yeah, and it was your birthday.
Yeah, last Wednesday I was like, oh no, I'm not. My family will murder me if I'm like, hey, I'm just going to do a quick Instagram live. They'd be like,
yeah, it's fine. You know what? We'll sing later.
Yeah. We did go out to dinner. It was a classic parenting fail. We went to a really nice restaurant, but I don't know. I didn't think it was such a nice restaurant that there wasn't a kids menu. And yeah, they were not into like bone broth and duck.
Bone broth? It's delicious.
Oh.
Aww.
Anyway, so there you have it. So that was that. It was okay, but they were a little like, what are we going to eat? What are we eating here? So
they're like, there's no food. There's nothing we like.
Yeah. I'm like, oh, you don't want the tuna tartare? That doesn't interest you?
Sounds delicious. And they're like, this is raw. Well, yeah, It's okay.
Even the pizza was weird. So it's like, you could pick off the stuff, I guess. I don't know.
I know. My kids are the same way. Like, I'll cook. And they're like, no.
Yeah. That's an ongoing debate at home too, although we can, bland it down quite a bit, but still my 9-year-old still will take plain pasta over anything else.
Yeah. So. Our house too. It's like pasta or macaroni and cheese.
Mm-hmm.
Oh, wow.
Yeah.
So that's fine.
Whatever. All right. And you survived COVID.
I survived COVID. I was vaccinated, so it was a breakthrough case. And I had the most mild symptoms. It was just like runny nose and sore throat, but I thought, well, I should test. Came back positive a week before we were supposed to go to Disney World.
Oh, no.
Yeah. So that got rescheduled, and my kids were so sweet. I took the test. I'm like, guys, I have COVID. We can't go to Disney. And they're like, you have COVID? Are you going to die? They were so worried. I was like, no, bless your hearts, but we can't go to Disney. They were like, whatever.
Oh.
So it is rescheduled. I'm glad it happened before and not during, because if we were in Florida and I got sick.
Yeah, that'd be a drag. Also, did anybody else get sick, or you?
No, I wore a mask for the whole week, slept in a different room, ate in a different room. And so far, everybody's good. My husband's vaccinated, but the kids are all too young. So they got
Right.
to hang out while I was sick and then stay home for another week of quarantine. So they really enjoyed that.
Right. Yeah. That's a good gig because they feel good. So
Yeah, they liked it. I'm like, but I have 3 kids at home and I'm sick.
yeah,
It's not fun.
That's not a party.
No.
Unless you put everybody in front of YouTube for the entire time, which is not.
We
also
may
great.
or may not have done that. Yeah.
Watched a movie during the day or something fun like
many
that.
Many of those. Yeah. So it was all right. I'm like mostly back to normal now. I was tired for a while, but thankfully I'm okay.
Yeah, I know. I'm angling to get my booster actually because I'm trying.
I've been thinking about it, although I had Moderna, not Pfizer, but I'm good now. I'm boosted.
Yeah. Now you're boosted for sure. Yeah. My sister actually just had her booster, and they gave her the flu shot and the booster shot at the same time, which is
that sounds awful.
She did fine.
Did she? Good. I got my flu shot yesterday, and I was kind of worried just having had COVID in a couple weeks, and it was totally fine.
Totally fine. I do need to knock that out too. Yeah. Anyway, well, do you want to talk about? We were gonna talk about supplements.
Yeah, but then we kind of figured that was a jinx topic because it didn't work out so many times.
So I don't think we've talked about injectables. Have we talked about filler? I honestly can't remember. If we did, it's
been so long. If we did, I'm sure it's all new.
Okay.
So yeah, let's talk anything that you can inject in your face. And actually, this is interesting too because the FDA just released that statement this week about hyaluronic. I don't remember how they phrased it, but it basically is using a dermal injector, which I have one. I don't use it anymore, but I used to use it for steroids and scars. And dermal injectors just send a high pressure injection with no needle. And they used to use them for vaccinations, I think. So there were med spas using these to inject filler. And I'm not sure why. Like, was it just there's no needle?
Yeah, so it was marketed. I remember it becoming a thing maybe 2018, 2019, and I was kind of intrigued, and then I looked into it more and I was like, oh no. And now I see it's obviously not a great idea, but it was marketed as like a needleless lip injection.
Okay, it sounds
blowing
awesome
the product
in theory, but like in reality you can't control how deep it's going, and you're pushing a product that's going to stay in place for several months and could grow bacterial biofilm through the dermis. Like with a needle, you know, you're like, it's minimal skin contaminant as opposed to all of the products being pushed through. So
shoving it in.
Yeah. So the FDA just released a statement saying that hyaluronic acid in filler products should not be pushed through a dermal injector. And I saw a couple med spas were like, that was their whole big thing.
Right. That's their selling point. I'm also, I think the more I looked into it, I got the impression that it wasn't painless or reduced swelling. So,
no, I mean, it's pretty traumatic. I said, I've used this on hypertrophic scars with steroid, and it hurts having liquid blasted through your skin, and it bleeds, and it's traumatic and not very precise at all. So
it's a good idea for steroid injections, though, into scar tissue. I kind of like that.
Yeah, it is and it's not. I used it for a while, but like it's kind of painful for people. And honestly, sometimes it just works better injecting with the needle.
Yeah. Well, okay. So then let's talk about. I mean, I think every time I turn around, there's a new filler out. So.
And Galderma's creating half of them. Galderma has so many fillers. My rep's not watching tonight, but Sam, you know I love you. But my goodness, there's Lift, Define, Refine, Kiss. Contour's the new one. It's fluffier. It's got bigger particle size with the same amount of basically like structural support. And then Kiss is more elastic, as is Refine. Define's got like good structural support like Lift, but we're getting into like very fine points where honestly I can't always tell the differences when I'm injecting.
Right. No, I agree. So they're trying to tailor the products to kind of specific areas of the face, but it's interesting. There's still some areas of the face that there is no FDA approval for, right? Tear troughs comes to mind. Or I
want to say regular Restylane is FDA approved for tear troughs, as is Belotero.
I was thinking about that. But yeah, or Volbella might be as well, honestly. I have to go back and look. Or pending that.
The
So yeah,
Volbella
so
I never got into.
yeah, well, what I heard about Volbella was the original syringe was 0.55 cc's, and I was like, what am I going to do with that? And then they switched to 1 cc. But yeah, we were talking about it. So let's go by body or face part. Let's maybe break it down that way, because that makes more sense to the consumer, right?
Right.
There's the major companies. There's Allergan, which produces the Juvederm line, and then Galderma
does the Restylane. There's MERS, which has Radius and Belotero, and then there's RHA, which is the new player on the market, and their product is, or that's Revance. Their product is RHA.
Right. And then also there's Versa, which I used a little bit.
I don't know that one at all. Yeah, and those are the major companies. Who is it who makes like Belafil and Artafil? I've never used them. They're permanent.
Yeah.
So
and then
I like them.
Sculptra. Yeah.
Oh yeah, Sculptra I use, but that's Galderma.
But you're right. Belafil and Artafil have collagen, and you have to do testing, and
yeah.
Anyway, so let's talk lips. And I usually categorize patients into, they want lips, they want structure, they want volume, they want pow, or the people who want a little bit of lip filler, but they're afraid to look like they have lip filler, which is,
I've also then had the patients who really just want to treat the perioral lip lines and want better definition. And then there's also a subset of patients who just have kind of wrinkly lips, and they're often younger, and they don't need a lot of volume, but it just fills out what's there and gives a little bit more. See, there's so many subtleties, even just with lip filler, guys. This is why you need to go to a specialist.
Right, and not get whatever product they happen to have stocked up. So, what are your favorite go-tos for lips then? What products do you like?
If I have someone who is new and just wants a little definition, I actually will use the Restylane 0.5 because it comes in a 0.5 cc, and that's the perfect amount for someone who just wants a little. I will also use Silk if they have a lot of little fine rhytids, because Silk is specially formulated for really superficial injection. It won't show with what's called a Tyndall effect, where it looks bluish. So that's nice for really little fine lines if they have a lot of that around their mouth. If they want a really, really natural look, I like the RHA 2 or RHA 3 or even Kiss, because those are all more flexible. So they look really natural with motion. How about you?
So I don't usually do the 1/2 syringe of Resty, but that's a good idea. I do like Silk for the fine lines. I really like that product. RHA 2 or Kiss for people who don't want too much pow. And then my other patients who want to look like they've done something to their lips, I really like Juvederm's Ultra Plus.
Yeah, I don't carry Juvederm anymore, but yeah, we used to use that.
Yeah, I think that gives a lot of bang for your buck. You could use Restylane Refine instead. That'll give you some structure.
Yeah, honestly, regular Restylane is who I use if people want a good pop, because it gives good structural support. So when we talk about fillers, there's 3 main let me think of the word, attributes that you talk about. And right now we've all been talking about hyaluronic acid fillers, which is a normal component of your skin and soft tissue, but they vary in particle size. So how big the little particles are, how much they're cross-linked. And cross-linking is just connection between molecules. Any polymers, all these little molecules held together. Thinking back to science days, the more cross-linking, kind of the stiffer it is, and the less cross-linking, the more flexible it is. And then there's G prime, and you'll hear reps talk about G prime all the time, but that's basically like how stiff and how much structural support. So you can have something that offers a lot of structural support, but it has a small particle size and is really flexible. It's interesting. We actually just have a chart taped to the wall with all of the fillers by flexibility and G prime, but it doesn't have particle size on it.
I know. Or the other factor, which is hyaluronic acid concentration. So they do vary the amount of the actual product in there, and then that can vary too. But you can have low hyaluronic acid concentration, but maybe a lot of cross-linking, or low concentration and not a lot of cross-linking. That usually means how much water they're going to take on, and then how much, what that cross-linking is. So that's proprietary for each company. And so in terms of what that ends up looking like. But in general, there are some products, like I would not, and I don't think most people would, put Voluma in the lips.
Right. Or
Because we know that's a stiff, firm product.
It's going to look really fake.
It's not going to move with your mouth, right? So I think Restylant's Kiss was advertised as having that expression technology. So it's nice and flexible, so it moves with your mouth and you don't have like stiff, weird Goldie Hawns in First Wife's Club.
Yes. It's also supposed to last a little bit longer, like right 12-month mark.
So if you remember when fillers first came out, they were 6 months was, I mean, 6 months was like, you're going to get 6 months out of it. Right. And I feel like all this cross-linking and the products have advanced enough that most people do really well and need a once a year.
Yeah. And especially RHA lasts even longer, up to 15 months. I don't remember if there was a retreat. This is another thing the reps always tell you, like, oh yeah, they say 9 months, but they retreat, meaning they get another injection. It's kind of funny. Right. Basically, they're all trying to differentiate themselves in a market where there's not that much space to be different.
Yes, I agree with that. Yes, the retreatment protocol. So yeah, what else was I going to say? So lips, I would say, yeah. So we've kind of covered that. What you want is volume and maybe smoothing out, hydration. I do use a fair amount of Juvederm products. So I think Volbella is pretty soft and will do more of like an internal hydration. I don't see a lot of patients that want that, but sometimes that's a nice option. Or velour, so something smoother. But I do like Kiss for that as well. And, you know, you're counting on it lasting hopefully 15 months.
Yeah.
And then do you inject with a needle or a cannula?
I do a needle. I've never loved cannula. I feel like it just is not necessarily less traumatic. And often you need a small enough cannula that it acts like a needle anyway.
Right.
But my big question, what do you do for pain control? Because lips hurt.
Oh, yeah. So I apply numbing cream. Dr. Taylor, who does injectables at my office as well, is not a fan of numbing cream. I know, but
I had lip filler without numbing cream once in residency because we didn't have numbing cream and I didn't want dental blocks. I would not recommend. 0 out of 5 stars. I didn't flinch because like my junior residents were all standing around watching my co-chief inject, but the tears were just running down my face. It hurt so much. And I had 3 kids without an epidural, and that still hurt a lot.
Yeah, I don't think I've ever used numbing cream for my lip filler, but I have a weird pain tolerance issue. So that's just, I don't use myself as a barometer for what any normal person would want. I've done it myself. I've done myself with needle.
Yeah.
No,
numbing cream.
And then I've also done cannula to myself to try and it's theoretically easier because it would be like one pass. Yeah. But I agree. I feel like that blunt cannula that's going through your soft tissue is kind of painful.
Yeah. I've done my own lip filler, but always with copious numbing cream. I also have a little, I'm trying to think what it's called. It vibrates. It looks like a little Bic razor and it vibrates. You put that right next to it where you're injecting and that helps a lot.
Nice. Right. So that's a distraction technique. Yeah. I do like ice. I think ice is also super helpful to numb the area first.
Yeah. I actually do all 3. I do topical for 10 minutes, wipe that off, hold ice, and then vibration and injection.
And so does somebody hold the vibration while you're doing?
I use it as like my second hand.
Okay.
So I'll just put it up like right next to it and use it to steady. And this was like when we had just reopened after COVID and things were quiet is when I started playing around with all these techniques because I'm like, yeah, I might as well get really, really good at this. The vibration helps a ton just from doing my own lip filler. And the topical we used too, we had played around with different topicals and the one we have now is extra strong. We use it for our halo peels and it's nice.
Yeah, ours is pretty strong as well. I think that makes a difference. Yeah. And less is more, just a thin layer rubs in and then it usually works. Like slathering on the numbing cream is usually not helpful. Okay, so lips. How about what's your most common area that you put filler in, would you say? And if it's lips, what else then? I think
besides lips, it's going to be smile lines and then marionette lines.
Okay.
Yeah.
And what product do you like for this smile.
It depends on the depth and how mobile there are. If it's somebody where it's just like kind of a wide depression, then I love Restylane. If it's like little fine lines, then I like Silk or RHA too. And the RHA products are really nice if it's a very mobile area.
Right, because they're very flexible.
Yeah, super flexible. They don't look stiff. If you've ever seen someone smile and their filler like really doesn't move, it's not an awesome look.
Yeah, I tend to like to put in Jupiter Ultra, which is a little softer. You can do Define there, Restylane Define sometimes. There is lots of options. I also will try to get people to do like
their
cheeks, right? Because that has a lifting effect, and then you're adding volume where you need the volume.
Right. Because here, it's not that you lack volume; it's that your cheek fell down.
Yes.
Put some filler between. You've got your middle fat pad and your malar fat pad, and there's always a little crease here. But as the fat pad descends, you get more separation. So putting some filler in and lifting will help correct those smile lines. But it does take a fair amount in the cheeks.
Right. So that's
one syringe to give a lift.
Right. So that's the companies will encourage you to do it that way, because then you're putting like 4 syringes in, which is expensive.
It does look amazing though. Like if you have a patient who is like, let's use whatever it takes, I don't want surgery, you can do remarkable things with a lot of filler.
Right. Yeah. 8 or 9 syringes. It's a lot, but you can restore, because a lot of it is a loss of volume or volume not in the right spot anymore. Yeah. But it is, you have to pick your patients. Some patients are like have full cheeks to start with. So then you don't want to create like a weird chipmunk look. Again, I think the most important thing is there's the image of somebody at rest. And then, like you said, when people smile and you start seeing weirdness, that's, you have to take in consideration what they look like.
I've seen, I remember the MERS rep when I first came out into practice. It's like they can get free product whenever they want, and the cheeks were like razor blade.
Oh yeah.
And she would smile and they wouldn't move. They were so
You're like, you can cut something with that.
Yes. Or just
so now I think
the shelf.
They're talking, I mean, some people like that look, but unless you're a Real Housewife, it's probably not a good, it looks unnatural.
Yes.
So I do like this.
Few people who truly have that cheek. Demi Moore, I think, actually does have that cheek, but almost no one else.
Yeah, and so they're talking now about when you fill this area out to also consider the jawline. So that's how you end up using all these syringes, right? So what it takes to pull this up, then you're going to balance that out with this lower area, lower cheek, and then jawline. And so then that's how you start adding, tons of filler to someone's tab. But you can also go slow, right? So you can do a little bit at a time. Say, okay, this is going to be a journey. We're going to put, a syringe in. You're going to get a little bit of a result, and then we'll keep building on that. Because I do think those products last a long time. It's generally kind of deep. It's not moving around as much as your lips. So 12 to 18 months is fair, and then you can kind of stack things.
Yes.
That's kind of, I love Voluma for that. The temples, I think, are an undertreated area, but I get it. It's an expensive area to treat without,
and I think
a lot of bang.
People don't notice. They don't really look at their temples and notice the hollowing out.
Right. So, yeah. It's nobody comes in and it's like, very few people are like, can you address my temples?
Yeah, it's always, they notice the lines, and then you have to point out, like, well, you don't have any volume here, and we want to restore that heart shape that a youthful face has.
Yeah.
So one of my common questions that I've been getting like this last year and never heard before that is, does filler migrate? Are you hearing that question more now? I don't know if it's been on the internet and there are all these articles about migrating filler. It's really kind of fascinating because there's not a lot of actual published literature on the topic.
I think my sense is that it's stemming from the fact that filler in the tear troughs, which is another Instagram popular area to treat, and not necessarily is the go-to for, like, if you're just going to put one syringe of filler, sometimes tear trough is not where you want to put that syringe. But since it's such a tricky area, I think the filler's sticking around longer. And then if it migrates up and gets caught in the muscle around your eye, it starts to create havoc. So I think that's part of it. And same thing, if you use the wrong filler in the nasolabial fold and it's in an area of movement, then
natural. Yeah.
Yeah, and it's migrating, but it's really, I mean, you're putting product in there and it's gonna get squished with the muscles of your face.
Yeah,
So,
there haven't really been any studies on this, except there was like a study on intraocular filler used to like build up the orbital floor. It was ophthalmologist. It was nothing cosmetic.
oh,
Like seeing if
okay.
that had moved around, because I did a literature search on this. You know, I also hear the area, like people talk about it bleeding into your upper lip. I don't know that that really happens. I've never had a patient come in and had the filler like totally visibly somewhere else. Sometimes you can have swelling somewhere else, especially lower down. And upper lip, I will actually inject filler under here because you lose volume there and you need some structural support. So I think a lot of times it's like weird swelling or things just not moving naturally. Hi, Wyatt, I see you. But I've never seen filler actually move from one place to another.
Oh, that's no, it's not going from your lip to your cheek. Right.
Yeah.
No, I think the migration I'm thinking of is it's just bunching around the eye.
Well, in the eye, the tear troughs are very tricky. And in my office, I inject those. No one else does. Because you've got the orbital septum. And if you end up retroseptal versus anterior to the septum, the filler can kind of like spread along the septal planes and do weird things. But when you think about it, as you're injecting it, you see it spread out. It's not this super precise thing. You know, if you've ever watched injections closely, you can like see the filler spreading out from the end of the needle.
Right. Yeah, no, I agree. So it's gonna move around, but that would be my sense. And I have had a lot of requests for tear trough filler lately. And I think in some patients, again, it's, you know, might be indicated, but a lot of times it's kind of filling out this area.
Yeah.
Yeah. And I think I tell them, listen, the danger is that you start looking like Nicole Kidman, which we could spend a whole half hour talking about. But I feel like someone filled out her tear trough, they filled out her cheek, like they filled out her jawline, filled out her. So now I feel like she's just one smooth, continuous surface.
Yeah.
And it looks weird. It starts to look weird.
It does.
So.
And that's when you should really just go get a facelift and get everything moved back up where it was.
Right. She's probably had one. I don't know.
Probably just shifted all the filler.
Yeah, raise the filler. Well, that was good, I think. I've seen people try to do filler behind the eyebrow. Again, that's, I think, for people who have money to set on fire. Like you can put some filler behind here to push the tail of the brow out. It's super subtle. It's like putting filler in your earlobe if you have a crease.
I've done earlobes. It's nice because I even thought about doing my own because you can see my earrings tilt down.
It's pulling.
And I thought about I might just put a little just to get my earrings out straight. They lose volume. The other area I will do is I'll do glabellar crease. If you're one of those people who didn't have Botox until you had that deep line that's indented and is not moving, it does not go away the first time you do toxin. And I love bringing people back a week later after the toxins kicked in, and you can just do a little bit of filler. This is, again, where I'll use the half syringe of Restylane, and it kind of pops out the dent, and after that, they're good, and toxin will do the trick. But it will speed that process along. But you have to be super careful because you've got arteries and veins here that if you inject, it can go back to your eye and cause blindness. So you definitely, you know, that's one of those areas, like I'm the only one in my office who will do it. My nurses do not do glabella.
Yeah, and otherwise, yes, that is not for, you know, JV team to do, for sure.
Varsity all
the way. Well, awesome. I'm glad we were able to get back on.
It's been a while.
All right, so we'll agree never to talk about supplements.
Yeah, never. You know, we should try to do a live when you're going to ASPS, right? Yeah.
Yeah.
That would be fun to hop on for a quick live. And actually, we get to meet in person, so I'm excited.
Yeah, that should be good. Are you getting there Friday, Thursday?
I'm getting Friday and leaving Monday because I'm on a panel like Monday morning. So I'll be there for the whole.
Yeah. I'm leaving Sunday because I got to make it back for Halloween. But yeah, we should definitely do a little.
I forgot it was Halloween, and I think my kids will survive.
Oh, yeah. It's like Christmas part. It's a big deal here. So we'll see.
Awesome.
All right. Well, yeah, we'll come up with something to talk about and maybe we'll do it from ASPS then.
Awesome. That sounds fantastic. That'll be in like 3 weeks or so.
Yeah.
Cool.
Right, cool.
Awesome. Well, I will see you in person very soon.
Okay. Bye. Have a good night.
Bye. You too.
Bye, everybody.